So when Jessica and Steve and Amar and I planned this session, we never imagined for a second that we would be in this hall with quite so many people. Because what we designed was a somewhat different kind of session, which was intended to be a small, intimate conversation about some of the key issues around joy in work. But we're still going to try that, even in this big hall, and we've got some technology that we're going to use that Jessica and Amar will introduce you to in due course. So this is the kind of basic flow of the day. 4 5-minute presentations from our 4 faculty, and then most of the time spent in discussion, trying to get to the kind of issues that you think are important, the assets that you have, maybe the little gems, we would call them, that you're finding as you start to work on joy, and then the pebbles in your shoes. And we'll see what we can do to remove some of those pebbles and give you a sense about how you might polish some of your gems. And then Jessica and I will talk a little bit about what next, what we're going to do now. So this is what we're going to try and do during the course of the next hour and 15 minutes. I want to start just by getting everybody on the same page when we talk about joy in work. So when we first started to talk about joy in work, particularly here in the UK, we didn't always get a very warm welcome. People would kind of cross their arms a bit like this and say, oh, joy in work, is it? But gradually, I think people are understanding that joy is really important. Dr. Deming said it was one of the top management tasks, that management's job is to create joy in work. And a lot of what Jason and I were talking about this morning around how do we engage people in order to improve our performance speaks completely to joy in work. And so we were really keen that we were going to do something beyond just addressing burnout. Important as that is, and burnout is at epidemic proportions, there's something about flipping that paradigm and getting beyond burnout to really try and create joy. And so we used Aaron Antonovsky's work as a springboard for that thinking. So just as Antonovsky says, health is more than the absence of disease, so we believe that joy is more than the absence of burnout. It's a positive thing. It's not an antidote to something that's negative. And then the other element that we're going to introduce into this session is this idea of co-production. So we're going to see if every single one of us in this room can leave the room more thoughtful, more informed, more able to make progress on joy in work, including the 4 of us who happen to be standing on this stage. And we've taken some of our inspiration here from the work of Elinor Ostrom. Many of you will know that work. It really started when she began to look at what was happening when police officers got off of their feet in the communities and into police cars. And crime increased. And she began to understand that what had been keeping crime at its previous low levels was the relationships. It was the fact that the beat officer could talk to people, could co-produce safe streets, could co-produce feelings of safety because they were in constant conversation and iteration. And so we're going to try and recreate some of that today and build on some of what we understand to be these kind of main elements of co-production. So treating people as assets, again, resonant there with what Jason and I were talking about, a focus on strengths. It's really important. Getting the support from our peer networks, we might think of that as agency at the interpersonal level. And then we're going to build off this. So this is work that at IHI we've been working on for the last few years now. Seeing joy in work through a progression that starts with asking what matters, that gets to identifying some of the unique impediments to joy, those pebbles in your shoes that I talked about, that then creates a framework where we can take shared responsibility for joy, and then we use improvement science in order to make progress. And that will get us those kind of outcomes. And we will draw, as we do some of our work together later on this wheel, not intending to go through all of it in any detail, except to say, as you'll see, this has activities at individual, team, managerial team, and senior leader level. And so we want to explore each of those three levels with you. We believe that one of the strengths of this particular approach to creating joy in work is that it's a whole systems approach. It sees a contribution for everyone in doing that. So just to stimulate our conversation and to take us into the next phase, we're going to hear from each of the other three faculty members. And we're going to start with one of the people who really helped Jessica and I tremendously as we were creating this theory. Steve was one of our original faculty as we developed the Joy in Work white paper. His work in the Mayo Clinic on joy has been groundbreaking and world-leading. So please welcome Steve Swenson to the stage.
Thanks, Derek. I believe, and I have evidence to support, that the single most impactful opportunity for us to improve the experience, outcomes, safety, and costs for patients is to take care of each other. As Derek mentioned, this is an epidemic, and what we will show you today is that there is hope and that there are validated, evidence-based things that we can do next Tuesday to help stem the tide and move us towards this aspiration of a joyful workforce. So I'd like to spend the next few minutes sharing with you two tactics. One is about behaviors, and one is about pebbles. Both of them build on agency that Derek and Jason shared with us this morning, and both of them build on the theme of co-production. And there's something you as leaders can do at any level of your organization. So let's talk about the behaviors first. Imagine if the leader of your group that you report to and work with genuinely, authentically, and regularly lived 5 behaviors. Number 1, I appreciate you. I'm grateful for your work. It's wonderful to have you on our team. Number 2, I really listen to your ideas. Let's figure this out together. I want to listen to your thoughts. Number 3, your leader communicates transparently with you. Here is everything we know about our work unit, our team. I don't know what to do by myself. Collectively, we will get the right answer. Number 4, I'm interested in your career. What's your dream 5 years from now at our organization? And let's work together and co-produce the dream for your career. And number 5, everyone on the team feels respected, validated, and included, regardless of phenome or genome or custom. Those are simple behaviors that I expect all of us learned by the time we got to kindergarten. And if you as a leader and leaders throughout your organization practice those, it'll make a difference. So we've studied this at Mayo Clinic now for over a decade. When I was head of leadership and organization development, as part of our annual survey of all 65,000 staff, we asked 12 questions of every staff member, custodians, nurses, doctors, and managers, about their leader, these 5 behaviors I just shared with you. And so on that 60-point scale, for every point upwards, there was a 9% improvement in joy in work. And for every point upwards, 1 out of 60 points upwards, there was a 3.3% reduction in burnout, emotional exhaustion, cynicism, viewing patients as objects instead of people, and confidence in your ability to get the job done. So the first tactic is measure leader index, manage to it, select leaders for it, and help them become better leaders. This is not about getting rid of bad leaders, it's about helping all leaders become better leaders to improve joy in work and to improve the outcomes, experience, safety, and costs for patients. So the second behavior is pebbles, removing pebbles. This is the IHI core of the IHI framework with the 4 actions that Derek shared with you. Ask, identify, commit, and improve. This work that's team-based, patient-centered, identifying pebbles in your shoes, frustrations, inefficiencies, things that sap the joy in your work. This process is a gateway drug for fulfillment. It's something you can do next Tuesday. You don't need a black belt, you don't need a systems engineer, you don't need an MBA. All you need is the humility to listen after asking, what is it and how is it that we could make our work unit better? We study this now at Mayo in 217 clinical units, 11,000 colleagues, and the combination of joint work, teamwork, and burnout all went statistically significantly in the right direction. And Dr. Mark Linzer, in a cluster randomized trial, showed that this IHI framework core 4-step process of ask, identify, commit, and improve reduced burnout by 21.8%, basically the same numbers at Mayo Clinic. We know it works. We know it works in big hospitals, in small clinics. It works on both sides of the pond. These 2 tactics don't need a capital budget. They just need your time and attention, and they work. Jessica Perlo is the director at IHI in charge of joy and work. What a fun and great job that is. And she's going to share with you 2 more field ideas from the field.
Thank you, Steve. So we promised you to talk about models for leading this work. And the one I'm going to share with you comes from Marshall Gantz. He's a community organizer in the States. He worked with Cesar Chavez. His pedagogy was used in Obama's presidential campaign. And it's been tremendously effective inside of healthcare as well. If you've met or worked with Helen Bevan or her team, she uses a lot of this as well. And what we're talking about here is a view of leadership that is accepting responsibility to achieve a shared purpose in the face of uncertainty. And uncertainty makes sense, right? Because when do we need leaders? Is it when everything's going well so we can thank them? That's almost never, I've never run into Derek's office to thank him. Actually, I have, because he's awesome. But for the most part, we run in when things are going poorly or when we need help, when there are challenges to our hands, to our hearts, or to our head. And so this is really a position, or a practice rather, not a position. And it's one where we are looking at leaders as part of a snowflake of leadership, not this traditional view where the leader's at the top and they make all the decisions that are pushed down, or if you're working below them, you're trying to protect them from things that aren't going well. It's also not this tyranny of structurelessness where you have no idea who's leading or how decisions are going to be made. And it's also not the middle. I think we've all been the lone ranger in the middle where you're the only one doing the work, and when your energy wanes or when you get pulled into something else, nothing happens with your project. What we're talking about here is developing leaders around us. And as I mentioned, it is a practice. And this is important because can you think of a leader who is nominally in a position of authority but isn't a great leader? Yeah, if you're from Scotland or the US, you know. But also, Have you thought of a leader, or can you think of one, who's in a school or a community or behind a kitchen table who leads every single day? And so really what we're trying to do is really harness that energy to bring people together, to have them decide together and act together for a shared purpose. And so there's lots of benefits in working this way. When you actually distribute leadership, you've built capacity around you. So you have a succession plan. If you get other work you have to go and do, you've developed leaders around you who can lead it when you're gone. You have a sustainable infrastructure for this work, so when this one project is done, they've already worked together, these teams know what they're leading, so they can be deployed again on new projects. It's also really neat because when you've developed leadership teams who've developed teams, they have their own ideas, and they start to create their own projects and improvement work for the organization. So there's lots of benefits in working this way, and lots of practices that help you do it. So one of the ways you can build a distributed leadership structure is to intentionally recruit people who have the issue or problem you're seeking to improve so that they can become authors of the solution. So it's sort of the heart of co-creation that Derek and Jason were talking about earlier, and the psychology of change, where you're co-creating because you've intentionally involved people on your team, on your leadership team, who can help you improve it. You can be really intentional about roles and responsibilities, be very explicit about norms on our team. Here's how we work, here's how we correct ourselves when we violate those norms. You can address power really clearly. We have issues around racism or sexism or ableism, and we talk about those issues and we try to address them. And you can also celebrate when you have addressed those power dynamics or when you have distributed leadership. So lots of practices all the time can help us do this, but I'm gonna share one with you that came from not too far away from here, Imperial College. So they actually helped us prototype test the framework that Derek shared with you to create the Joy in Work framework. So in 2015, when we were first starting this, they used the work with us to relaunch their QI hub. And Bob Klaber's here, Sheena Vishram and Myra Malik were also on his team. They were super intentional about building a distributed leadership team around the work. They also used appreciative inquiry, really trying to help stakeholders identify their self-determined aims in the work. And they did an asset-based approach to it where they looked at bright spots. They did speed dating around what makes for a good day for you. They did RCTs, or randomized coffee trials, where two people who wouldn't ordinarily work together had an excuse to do so, to come together and learn from each other. They did after-action reviews for some of their culture of safety work. Really neat things around social media and safety selfies. So they really made it fun. And in the end, they were able to develop that capacity. They had more engaged, more appreciative staff who were more engaged with one another as well. So lots of benefits in working this way, and we're going to share more about this in a bit. But before we do, I'm going to invite my colleague Amar Shah to come up here. Many of you might know Amar. He is a Chief Quality Officer at East London. He's also a forensic psychologist and one of our leaders of Joy in Work.
Thanks, Jessica. So my two tactics for leaders around creating a more joyful workforce. The first is really to think about how you run your organization. What is your mental model around how you are going to continue to improve performance and tackle the most complex challenges and opportunities that you face as an organization? I would suggest to you there's increasing evidence today to support that quality improving organizations that really embrace continuous improvement as their operating model, see their staff be much more engaged and more joyful at work. So that's the first thing I'm going to offer to you, is to consider really how you can become an organization that embraces quality improvement. And what you're really inviting people to do when you really genuinely commit to an improvement journey as an organization is you are saying to your workforce, we do not know the answers to the really complex challenges we face now and will face in the future. And we need your help to discover better solutions. Our job as leaders is to provide you with an environment in which you can innovate, where we will support you. We will give you the skills and tools you need to be able to make the changes you know you need to make to be able to make the care and system better for those we serve. That is a really enticing, inviting offer to staff. There's no surprise then that people who work in such an environment feel they have more control over the system in which they work. They feel they have more power to be able to make changes. They feel they have more autonomy. And so I would suggest to you, the first tactic as a leader you could consider is to really think about how you can further strengthen your organization's embrace of quality improvement being your operating model for the organization. We, 10 years ago, were a fairly traditional healthcare provider. We hadn't even heard of quality improvement. But over the time that we have spent really learning about how to become a better learning organization, using quality improvement as our mechanism to engage everybody, our workforce and beyond our workforce, to help us continue to improve the offer we make to our communities, we have seen wonderful things happen, both at the individual level, but also at the team level and the whole system level. 3 levels of agency that Derek and Jason taught us about this morning. So here is our data on our staff experience. We're the red dot here in comparison to every other NHS provider in England. And you can see that over the years that we have started to get our quality improvement culture stronger and stronger, we have seen increasing and better feedback from our staff about how confident they feel that they can make a change in the place they work and how satisfied they are with their job. And yet, this is not going to be enough. So despite some of these scores being at the upper end of what we see in the NHS, there is still a lot of variation within the organization. And complex organizations are always going to have variation. So my second offer to you all is to consider how you would use improvement science to enhance joy within your work. So we have started to tackle joy and really promote joy in our teams by using a systematic method to really test and learn, giving the power even further to our staff and our service users to work together and really try to redesign what does a joyful experience at work look like. We have a strong belief that joy is related to the people you spend your time working with and the people you spend your time interrelating with on a day-to-day basis. So our focus around this is really around microsystems, teams, coming together and really thinking about what would bring us joy. What is it in our day-to-day work that we find really meaningful? But also, what are the things that are getting in the way of our day-to-day activity? And we are using improvement science to really further deepen our learning around this. So it starts with a very clear aim, as all improvement projects do. A really clear system-level aim beneath which every team creates their own aim. It then starts with a way to measure, real-time, daily measurement of how people feel in our teams, and starting to use that data to understand variation and make this transparent so everybody can learn from each other. People can see their own satisfaction and engagement on a day-to-day basis, but also their team's scores and every other team's, so that we can learn from where things seem to be working really well. Thirdly, we have a change theory. And again here, the changes are driven by the teams, ideas that come from within the team itself. Again, further giving a sense of autonomy and power to teams to be able to make something happen which will enhance their joy in work. Here are some of the teams and their change ideas plotted against the joy in work wheel, which Derek showed us earlier today. And then lastly, a system for learning, an intentional design that enables people to come together and learn together with a really clear shared purpose around joy, ensuring that our staff satisfaction and well-being is enhanced so that we are better able to meet the needs of those we're serving. Having a shared language, which is the use of improvement, making sure and reinforcing the sense of autonomy that our teams and individuals have to be able to test things and learn. Not always going to work, but to try things and learn in the pursuit of a better experience at work. Really distributing power within teams in non-conventional ways so that team managers are not the ones who are responsible for the team and how the team feels, but the whole team together collectively own this. And then bringing people together so that they can learn from each other and share ideas. So those are my 2 offers to you all based on our work in our organization around, first, really thinking about embracing continuous improvement as your mechanism in the organization for really delivering and improving what you offer. And secondly, using improvement science to get even closer to what it really means to experience joy in our day-to-day interactions within our teams. So I'm going to invite Jessica back up to the screen. You've heard from Steve, Derek, Jess, and myself with a few offers and a few bits of learning from our work, but we really want to now invite you all to share what you know and what you have to offer to the rest of the community. Jess.
Thank you. Yeah, so what we wanted to do was flip the classroom and really get to what's coming up for you as you're listening to us talk about joy in work. But before we do that, we want to get into an asset-based mind again and to think about what's going for us. So first, we're going to start thinking just at the individual level. So what's going on for your local setting around your individual assets for this work. So I'm just going to ask you to, for a second, just kind of reflect what's going well for you that you might bring to this work as you start to improve joy in work. And at the individual level, you'll see it's in the corner of the slide here. This could be things like an improvement infrastructure. A lot of your colleagues really already know improvement, and you can use this easily. You have a joyful workforce. You actually kind of celebrate together a little bit. There's some energy for this work. You have a colleague who would care about this with you. So just think for a second, I'll be quiet, what might be working for you from an asset-based approach? And now we're actually going to get into Slido, which I've never done before, and is going to be a little bit of a challenge. But if you'll go to slido.com and enter in, on your phones, Quality 2019, you'll select Hall 5, and that will get you into our questions for this portion. Give me a thumbs up if you've made it into the hall. Anyone? I'm getting fingers, but not thumbs. Yes? Okay. You'll have another chance to do this. So if you haven't joined, you still can. I'm going to keep the hashtag up here that you'll need to join. And again, it's slido.com, hall 5. So now we're going to ask you about challenges. These were probably on your mind already as we were talking about joy in work, but the question now is, what challenges do you have to joy in work at the individual level? And I'll ask our team to put up the Slido poll. You can see we've seeded some of these for you around staff morale, time, inefficiencies or waste. And then there's an other category. If you've selected other, there's also a question tab in Slido. So if you want to enter in what other is for you in the question tab, you can do that too. All right. It seems overwhelmingly, I know people are still voting, like a lack of time is a real barrier for you. So I'm going to ask our faculty, Steve and Derek are out actually walking the aisles, and Amar's here too, to be able to speak to what have you done, or you've seen done successfully to overcome this issue of time.
Well, first I was wondering whether anybody who typed that in wanted to say anything. Anybody who said lack of time is a problem for them? You want to say more? Remember, courage. Courage.
You have a hand right here in the middle. Do you mind going over to the side to where Derek is? Thank you.
Thank you. I'm Amar, I'm a Deputy Medical Director from Portsmouth Hospitals. We have huge challenges in terms of our workforce, in terms of recruitment, which does sort of secondarily lead into that challenge of time. We have really big issues in terms of staffing numbers, particularly on our boards, and we're always at a stretch. It's always difficult for us. We have done some really exciting quality improvement work as part of a nascent quality improvement journey over the last couple of years. And actually what's been stunning is how incredibly able the resource in our organisation is, how much talent there is, how much we could do, but the difficulty has been letting clinical people have the time to do that work.
Yeah.
So let me just share a thought with you. If you look at the 3 items on the survey, the inefficiency, waste, the morale, and the lack of time, they're all related. And so one of the ways forward is to address the inefficiencies and the waste in the system in order to improve morale by increasing the amount of flex time that professionals have. So Mayo, no one gets a more resources, another nurse, another tech, another operating room, unless we examine the process first. The mantra is no new resources to an unexamined process. Examine the process, every one of them, guaranteed, will find some opportunity to drive off waste or variation defect. Instead of parlaying that into you working harder, parlay it into more flex time. So you buy the time by driving up waste and efficiency and improving morale.
Sorry, I'm confusing the sound people by sometimes speaking into my bell mic and sometimes. For me at least, so this is the thing I hear most of. This idea that we lack the time to do this. And it's an entirely legitimate concern. And we have to, I think, move beyond thinking of joint work as a project, as something we're going to add on to all of the other things we're going to do. And instead, I think, take some of what Steve has offered us by way of advice. And also, I think, some of what Amar said about committing to improvement as your method. Because that's going to become the way in which we do our work. And therefore, we're not asking people to take on anything that's additional. We're asking them rather to solve problems differently. Solve problems in a way that's going to help us both make progress for patients and families, but also release time. And Steve's point about inefficiency and waste is also highly resonant with me. A lot of people remember a project in the UK, which I think in England was called the Productive Ward. In Scotland it was called Releasing Time for Care. And we know from some work that we've been doing recently that at least 30% of what we require our clinical teams to do adds no clinical value. And so if we could get at that, then we would certainly release some of the time that we need for people to do the productive work. Yeah. It would really give them joy. Mark, does that make sense for you?
It makes sense, but I would also add that I've seen teams around the world through the virtual course that IHI runs do this work in ways that do not take a lot of time. So if time is a real difficulty, and actually it can be hard in some settings to get your whole team together if you're working shifts, there are lots of creative ways that teams use to really just start asking these questions. Ultimately, there can be nothing more important than asking what matters to the people who are working in a unit. And if you really don't understand that, you're going to struggle to support your team and each other. So finding creative ways, even starting a conversation around lunch or having a breakfast or having something on a wall that people can contribute to, starting to ask the question of what really matters or what's getting in the way, and taking away stuff that doesn't add value. So probably one of the most powerful things as a leader you can do is give permission to teams to be able to stop stuff that doesn't add value, to really focus on these critical questions.
And Amar, there's a question in here for you about how ELVT measured. How did you solicit some of the ideas and how did you measure it?
So I would say for measurement, Steve has a much more sophisticated measurement system than we do. Measurement for improvement is an inexact science. There is no perfect measure. It's really about what's going to help you learn. So really starting to create with your team a question or a set of an instrument that will help you understand how people feel. And joy is such a transient thing and such a fragile thing in some ways that you have to measure frequently, I think, and really use that to understand variation. Are there certain days of the week or are there certain hours of the day in which that we could do something differently or really learn from. So starting to get a standard instrument that helps us understand joy. We co-created with our staff a single question, which for us adds meaning around what does joy actually translate to in our day-to-day work. And we started off with very basic tools to collect data, including just tokens in a jar, and then moved from there.
One color for a good day, one color for a bad day, sort of thing. Yeah.
I love what you're doing, Amar. I love what you're doing these content runs. It's wonderful. And another approach to build on that and support it would be our Practice Mail Clinic, which is an annual, robust, confidential, anonymous survey of all 65,000 staff. So we have joy in work information down to every work unit level, and we have a leader index down to every unit level. And we share it transparently with everyone. So each leader knows how they're doing relative to the rest. And the joy in work is a composite of a handful of questions that address meaning and purpose and camaraderie and passion and teamwork and psychological safety and camaraderie. And so we put those together, and we have a heat map then of the whole organization, from ICUs to family medicine to accounting, where we see where leaders have an opportunity to improve and where the morale or burnout or joy isn't where we want it to be. So then you've got, it's one of the fundamentals of improvement process is to have a baseline and so you can see if you make a difference or not.
And I want to address in here, there's a poll question that seemed to get a lot of votes that came from Meg Park. She said, a hierarchy obsessed with results. What would you do about that?
I'll give you this mantra of 3 things, and it's thin rule book, wide guardrails, and lose the middle manager. So leaders, even if Jess and Amar knew the answer about how to make your practice more efficiency, grow, or to bring you joy, you wouldn't have half the result as if you identified it yourself and improved it yourself. So the best characteristics of leaders for improving joy are ones that say, we've got a problem, let's figure it out together. We want this outcome, and we want, I wouldn't have the answers, and I'm not telling you as a middle manager what to do because someone told me what to do. So wide guardrails, give flexibility to the team, look at outcomes instead of processes with a thin rule book, and be a leader, not a middle manager that is just saying, well, we have to do this because Derek told us to do it. We're doing this because there's a challenge, and we know it, and we can figure it out better than Derek can.
That's almost always the case. So I think it's a great question, because I guess I have a confession to make, and it is that I'm kind of obsessed by results. I almost think as part of my job as a leader is to be obsessed with results. And so I think then 2 things matter. So what are the results that you're obsessed with? And if we thought about this through an improvement lens, they wouldn't just be our work outcomes, but we might have some balancing measures that were around some of the things that we just talked about. Right. Because I'm not obsessed with results at any cost to the people who are relying on to get those results. And so at IHI we use 4 quadrants. That's why they're called quadrants, I guess. So we look at our results. Are the people that we're serving happy with what we're doing with them? We look at our reach. Are we getting our signs of improvement to more people? We look at our finances. Am I able to pay IHI's bills at the end of the month? And we look at joy in work. And we're always looking at those 4 things together to make sure that they're in balance. And so I'm okay with the obsession about results, but you need to be careful about the results. And then in my experience, a hierarchy is a sign of something. And in our organizations in healthcare, more often it's a sign of absence of trust. Where we can't establish trusting relationships, instead we establish hierarchy. And I think the challenge for us, for everybody in this room who's interested in joy, otherwise you would have gone to one of the other sessions, is to give the people who are currently obsessed with hierarchy a better alternative. And give them a vision of the future that's more attractive than the status quo.
Thank you. So I want to address just one more before we move on, which is, if you scroll back up, how do you cope when you feel that you're the only one who's interested and you feel burnout? So I want to speak to this because it comes up a lot. Our framework intentionally has individuals and our own well-being as a fraction of the work that needs to go on. It's an important part of the work, but it's not all of the work. And you hear this a lot when organizations try to work on joy in work and they do really great wellness efforts like mindfulness-based stress reduction or subsidies for gym memberships. These are all great, but they're not the whole picture. But I do want to say, as an individual in this work, I have felt this too. It can be exhausting when you're really excited and you want to do this and no one's there with you. You're almost like that wet dog that Maureen Bisignano talks about all the time, where you're excited and you shake and everyone's like, okay. And so I think it's an important part of the work to take care of ourselves. I've also seen in healthcare, you are the least likely to put your oxygen mask on first and take care of yourselves. And so there's a lot of work to do around our own well-being in this work. And one of the things that has been effective, and actually Brian Sexton's work at Duke University is super interesting for this, because he looks at gratitude and the effect that 3 good things, or reflecting at the end of the day on 3 good things that happened for you and your role in making them happen, is more effective than Prozac over time. So there's things that we can do within our daily work, within ourselves, to keep ourselves whole and to take care of ourselves as we do this work. So I'll just say that. And then I think we should move on to the next question, which...
About the manipulative, powerful leader, I have some good news. And that is that leader is unlikely to thrive over time. There's actually very powerful evidence base that shows that those leaders who act in that kind of way do not do well in the longer term. So my strong suspicion is your powerful manipulative leader will themselves burn out. And if you want to talk to me privately about that relationship, I'm willing to help.
All right. The next question really relates to that team level of the framework, things that managers and supervisors have more control over, things like participative management and camaraderie. And so you can see here some of the challenges that we've put into the poll for you around the skill or style of your supervisor or manager. Claire Shields, who was helping us create this poll, said, well, those are really different things. You can have a skillful leader or manager who's just got a really abrasive style, or you can have someone who has a great style, but they're not very effective. So basically in this bucket, I'm getting into like the skill level of the people that are leading your teams at the middle. The second is trust in relationships, which Derek touched on briefly. No sense of team. A lot of times we hear people aren't even in dyads, or don't really feel that sense of camaraderie or connection to their coworkers. And again, we have another category here, which you can go into the comment, or questions rather, field in Slido and comment in what's coming up for you. Any reflections from our faculty so far on the results?
So I'd start by saying that the top one there that you've picked is going to have a huge influence on climate in the team. And yet, I think we all need to appreciate that everyone is learning and needs to be given the opportunity to hear from others how they're doing, both their strengths but also the things they could do differently, and the opportunity to try new ways of being. So all of us in a team are continually learning how to be better and be more effective. And that doesn't exclude the people who are in formal leadership roles. So one of the things that we could try is to get better at how to offer feedback. And one of the things we should practice is really being able to give people feedback about the things that we spot in their behaviors that really were useful and productive and positive, and make sure we are reinforcing that. But equally, being able to say to someone when they did something or behaved in a certain way that wasn't helpful, to be able to really have a safe space to be able to have a conversation to explain why and what we would have preferred to see instead. I think if we can start to get a really habit around feedback in our teams, it will go some way towards getting underneath some of that difficulty.
Amar, I think you explained that really nicely. Essentially, you identified the style of supervisors or managers as a top opportunity, and I think you're absolutely right. I think the single most important thing we can do is to have you or your leader behave in a manner that's participative, that engenders trust, and engenders the collective decision-making of the team. And so we took those 5 behaviors of the leader index, started with 242 physician leaders. It worked so well with that, we scaled it to 3,300 point-of-care leaders. So everybody, the leaders in accounting, all the nurse supervisors, all the paramedics, every one of them has a leader index. And the one element of a leader assessment I didn't share with you is emotional intelligence. So we have 4,400 physicians at Mayo Clinic. Every one of them, during the 3-year onboarding, undergoes an emotional intelligence assessment. Leaders and team members that have higher levels of emotional intelligence have lower rates of professional burnout and higher rates of joy in work. So we don't do them pass-fail for their EQ, but we coach them and help them understand that if they want to be a safe physician or nurse or pharmacist, and if they want to be an effective leader, they need to, as Derek says, listen to understand and connect with people instead of coming in with the answers.
Yeah, I mean, I think this is one of those areas where it's often useful to take the supervisor or manager out of the work situation and into somewhere different. So I love the idea from Imperial of the randomized coffee trial. And I see a lot of people who are struggling with their supervisor or manager try and deal with that struggle in the work environment, on the ward, in the unit, on the department. And that's rarely the right place to try and deal with it. So see if you can, if you're struggling with these kind of relationships, to take it out of the environment, just to change the place in which you have the conversation. And then the other thing that I've seen work very effectively is to enter into those conversations not with an inquiry mindset, not going straight to complaint. People actually, there's a whole science around feedback and how to give it and what impact it has, but people don't normally really want feedback. They'd much rather have feed forward. So to say to them, rather than say to them, you know that thing you did to me, or did with me, or did on the award the other day, that really didn't work for me. To say something like, you know, I'm curious about why that might have happened. And, you know, maybe the next time we face that kind of problem, we could do it this way. Rather than give them feedback on what's gone and in any event not changeable, focus your attention on the future. So those would be my 2 sets of tactics. First, do it over coffee. And second, inquire and think about the future rather than dwell too much on the past.
Thank you. Do we want to take a question from the audience?
My name is Sabrina Udwai. I'm a consultant obstetrician. I work in Imperial. And I'm also a flow coach, a part of the Flow Coaching Academy. And I run a big room called the Antenatal Big Room. And I struggle with, as a clinician, we have lots of hierarchy, lots of tribalism. And I really struggle with giving feedback or feed forward in my role as an improvement coach for the non-clinicians. and the admin managers and the general managers, because traditionally clinicians stay in this lane and we look after the clinical staff. And now we're trying to do things differently. We're trying to co-design. The big room's really good for that, bringing people from all over together. And it's very difficult for me to jump into that other lane. Yeah. And people feel like I'm in kind of, you know, not doing the thing that clinicians should do and not allowing other people to do things their way. And the challenges that people talk about hierarchy in clinical medicine is equally pervasive in the non-clinical side and management in our healthcare system. So I'm wondering if you have any tips.
Can we see a show of hands? Has anyone else encountered this issue? Yeah, quite a few. Has anyone seen anything be successful? All right.
My response is this is a culture of support and coaching and mentorship and role modeling and communication. And so if that's not established as an expectation of all leaders in your organization, where everyone has a relationship with some leader or colleague, and on a regular basis gets feedback on how they interact with teams, then you could introduce that in a very subtle, positive, supporting each other kind of way, and eventually it should become institutionalized. So every leader of a group of no more than 24 colleagues, whether they're nurses or doctors or managers or pharmacists, would then have the responsibility of the team dynamics and the culture of their team. And you can measure that with surveys, you can measure leader index, but the feedback in a non-threatening, I want to make you a better team member, I want to make you a better leader, I want the morale of our team to become better, comes up. So often when you have these pebbles in the shoe discussions with teams in a psychologically safe environment, often the pebbles are relationships and team dynamics and leaders. And that's another way you could start this, is with a very psychologically safe meeting of different members of the team, maybe by rank and role or something, where you identify those with someone else helping communicate, this isn't working because Swenson doesn't listen to my ideas ever. And Swenson needs that feedback. So it's critical, and the format of an improvement team is a wonderful way to identify some of those dynamics and help work them better. It's a wonderful way to improve psychological safety, is a thoughtful, open team that gives feedback to each other in a safe setting.
And I think the thing always to have in the back of your mind is that even in high-functioning teams, conflict occasionally is going to happen. It's inevitable. And the only choice we have is about whether it's productive or disruptive. And I think one of the things that the Joy in Work framework can help us do is make sure that conflict is productive. So if the answer to what are the pebbles in your shoes are multiple rather than single, then we need to be responsive to that. We need to adjust our course. We need to plan the next phase, which is about getting a shared understanding of what we can actually do in a different kind of way. But I see too many people who get into this, and it's because they hear the conflicts, because they get the occasional disengaged person or suspicious person or hostile person, they just back away. And our experience so far of running this, and another 800 or so teams just about to get started to do another round of it, is that first question about, okay, what matters here is really important. Yeah. And if ever you're just stuck about somewhere to start with that very simple question. Okay, just tell me what matters. And it helps you just get beyond some of the conflicts and into more productive territory.
Yeah. Amar, I'm wondering if you want to speak to the question that's bubbled up the most here around junior doctors and how to engage them when they're rotating too quickly through the system to feel a sense of team.
Yeah, I remember rotating through 10 different providers in about 6 years. It's equally likely that organizations don't emotionally invest in people who are only transiently with them. So I think this is a real risk. And the data supports this, that junior doctors, these are doctors in training, they're not junior by any stretch, doctors in training are experiencing symptoms of ill health now and disengagement to levels we've not seen before. But I think what we need to really focus on is the fact that even if you're in a placement for 4 weeks, like medical students are sometimes, you do get emotionally invested. And your connection is to the purpose, right? It's really about that connection to the purpose of the team, which is really grounded in what matters to the people we're serving. And on that, we are all aligned. So if we really hold on to the question that Derek just said to us is probably the grounding factor, and we really make sure we have the voice of the patient in the room all the time, then I think we will be able to better recognize the role that all of us have to play in ensuring everyone has a great experience and outcome of care. And doctors in training have a huge influence on that. So I think if we focus on what matters most and we make sure that our service users and patients are there with us when we're having these conversations, we're much more likely to really understand all of our roles around that single shared purpose.
Yeah, that makes a lot of sense, especially coming from the psychiatrist. I believe you.
If you look at professionals in training, like nurses and doctors, junior doctors, pharmacists, anyone, they're the colleagues that have the least amount of agency. They're in a system that they are traveling through rapidly and have very limited opportunity to change the system. And this is a systems issue. The one thing they can do is to build this social network. And the evidence is crystal clear, including lower cortisol levels in groups of colleagues get together on a regular basis and have a conversation and maybe a biscuit. So during that phase, the junior doctor, the junior nurse, whatever junior professional stage, you can't lead the Pebble discussion and you can't change your supervisor like you can later in your career, but you can build a social network that is your safety net of camaraderie that makes a difference for your well-being while the system fixes itself. And then you can be the solution to the system once you're not a junior doctor, junior nurse, or junior pharmacist anymore.
All right, last question. It's going to have to do with the system level. And what we're looking for here, while it's coming up, you can think about some of the assets you have going for you at the system leader level. And these could touch on some of the things coming up here, but they also might be challenges for you. So things around, we don't feel safe speaking up. There's low psychological or physical safety. A lot of times people don't feel safe. There's injuries all the time in healthcare. It's 30 times greater than other industries, including manufacturing. A lack of connection to meaning and purpose, or feeling chaotic or little control over your work or your schedule, and other. We'll give you a minute. Again, feel free to put your other comments into the questions field. Any comments from our faculty as these come in?
I noticed the biggest one, there's little control over work schedules. And so one of the big mistakes we made in leadership at Mayo on a regular basis were group practice led by practicing doctors, practicing nurses in diabs and triabs. And it always makes more sense. We can just control the schedule and access centrally and have the system work best. And every time we do that, we end up retreating because the staff feel like they have little control over the work and the work schedules, and they don't have the right amount of time for this patient, or that patient's better seen by someone else. So we retreat from what we thought was a great idea and say the best person or team to take care of this are the ones closest to the patient. We need this outcome of access and number of patients and teamwork and quality and patient experience, but you can figure out the schedule and the right patients for the right team member. And so it's a matter of ceding that agency to the people closest to the patient, because they're in the best position to do it. Thin rule book, wide guardrails.
Derek, what would you recommend, this is coming up in the questions, for a leader that just doesn't seem to understand the capacity that's really needed to get the work done?
Well, leaders are not infallible and don't necessarily have the answer. So if you believe that to be the truth, you need to find a way of the leader hearing that truth. Mm-hmm. My inclination would be not to do that alone, but rather to socialize the ideas, but like that network that Steve talks about. And my inclination also would be to approach that issue from the position of both meaning and purpose and humanity. We sometimes forget that leaders are people too, and they do care about the work. They do recognize the why. Often our why across their organisation is the very same, and it's just never given a voice. And I would approach it from what are the implications of their actions rather than from the action itself, so that they can start to see. So what is this meaning? This way of being that I have, this behaviour that I'm exhibiting, what impact is it having? But a lot of this is dependent on a leader who's willing to behave in the way that Steve described in his earlier remarks when he described his tactics, where you've got a leader who will embrace those 5 behaviours. Joy is much more likely. If the leader refuses to work in that way, or sometimes even worse still, sometimes does and sometimes doesn't, then that's a problem. And we have to help the leader to see the consequences of that way of behaving and operating, and help him or her to find some different approach, a more productive way forward.
And it sounds like you're suggesting we include our leadership team in those conversations about what matters to you.
I think the point Amar made about including our patients in those conversations. It's amazing how many leaders I see change their approach when a patient is in the room, when they hear it from a patient. Gail, you were talking a little bit about this just a moment ago. Why don't you just ask the question? You were whispering in my ear.
Yes, thank you. So Dr. Shah, you brought this up just a little bit a few moments ago, but what I'm asking for you to tell us about is your experience in moving joy and work through co-production with patients. So I've been hearing about co-production with our staff, which is important, but also with patients brings the deepest joy and work for the people I work with.
I'd say we're still learning. We're still learning about how to do that. I think we've started some conversations, and I think what we've really learned from that is that our service users, our patients, are really well skilled at being able to recognize in the caregivers when they're having a good day or when they're not having a good day, and also well able to help us recognize how they can contribute to us as caregivers having a better experience at work and being able to give back more. So I think we're starting to really open up that in a bit more of a deeper way as a dialogue. But we've got some teams that are really starting to get underneath the question of how can we work together to really ensure that you as a healthcare team feel safe enough, secure enough, feel well enough to be able to give us the best that you have to give? And what role do we as service users play in that? Because often what we'll hear from staff is the most meaningful activities, the things that really bring them joy, are their interactions with their patients. And so that is for us an asset that we need to really strengthen and build on. And sometimes the pebbles in that relationship are the things that we can do something about. It's the IT system, or it's not having enough time and control over our work so we can spend the time we want to be able to spend in that relationship. So I think the more we have that conversation together, the more we are likely to actually build on one of our strongest assets, which is this therapeutic relationship we have, which brings us a lot of joy.
Thank you. I'm going to bring us back to our slides just for a moment, and I'll ask Derek to join me up here. Our request to you now is just to think for a moment and pair to someone next to you. From what's been shared from our faculty today, what's resonating for you? Where might you take action? And to Steve's point, what could you do by next Tuesday? So we'll ask you to think for a moment and then pair with someone next to you and make this commitment. One thing that you can do to start to co-produce joy locally. You're really drinking that.
Oh, it's good. If you have a hangover,
Huh?
if you ever have a hangover,
Really?
that's the stuff.
I'm scared of it. We've got this slide and then this one.
And that really helps us, I think, talk more about what's ahead, isn't it?
Yeah. Okay. I think that's it. Which ones do you want to do?
Which ones do you want to do?
Okay.
Why don't you do that and I'll do the other two.
Okay. Thanks. Should we ask folks to share their commitments or just wrap it up?
I'm not sure we've got time, have we?
8 minutes?
We probably don't have time for a lot of sharing.
Okay.
Why don't we invite them to, we got a join work at IHI?
Yep.
Why don't we invite them to send it to that?
All right. Thank you so much. A few more comments before we wrap up with you. I hear this rich dialogue. I want to invite you to share with us some of the commitments you've made to each other. So we have your comments from the Slido, which I'm going to take a look at. And we welcome you emailing us at joyandwork@ihi.org if you want to share some of the commitments you've made or any of the questions that are still lingering for you. Can I hear you up here? Thank you so much. I'm so glad that you're excited to talk about this together. Can I grab our slides again? So we want to invite you, we've asked you to make a commitment to one another, but we want to make a commitment to you as well. So we've asked you what you're going to do by next Tuesday. If you haven't made a commitment yet, we want to encourage you to commit to to have one conversation around what matters to you with one of your colleagues or your staff. To test one change, just one of the things that our faculty were able to share with you today. There are more on IHI.org if you're stuck for ideas. One change to co-produce joy in work by June. And then reassess opportunities for interventions at all levels of your organization. To our end, we have a few commitments to you. One is our white paper, where you can read more about the Joy in Work framework. It's available free to download on IHI.org. We also have sessions. If you're interested in coming and hearing more and learning more from our faculty, we'll have sessions in Taipei. And we have 2 more invitations to you.
So we hope you might be able to join us in our next online course. So this would be our 4th. And they are incredibly engaging and positive. People are getting real value out of these, and so are we. we're learning a tremendous amount as we go along, and I think everyone will be better than next. Incidentally, I'm getting some joy in work here from my iron brew, which was left over from earlier. The Scots in the audience will know if ever you feel, if you know you've had a night on the town, maybe a glass of wine too many, you wake up in the morning with that slightly hazy head. This is the antidote. But iron brew is more than just the absence of hangover. It's much better than that.
You're just inviting memes to be made.
This is also, you get diet iron brew. Never trust the diet iron brew. If you need iron brew, you need the full fat stuff. You definitely do. So maybe you might want to join us on our virtual project. I was digressing there a wee bit, did you notice? Or we're about to just kick off a new Joy in Work results-oriented learning network. We'll be looking for a relatively small number of teams from across the world who will be the first learning community, the people who will break the new ground, who will, if finding joy in work is an equatorial jungle, then this is the group who've got the machetes and will help us find our way. So again, that's something you may want to consider joining starting in the autumn of 2019. And so all it remains for us to do, for me and Jessica and Amar and Steve, is thank you for joining us today. Thank you for being part of that participative conversation. And we hope that along our respective joy and work paths, we'll continue to see you. Thank you very much.
Thank you.